Medical ethics does not care if you're vaccinated, unvaccinated, if you're a criminal, if you have HIV, if you have any other communicable disease. We do not care. I'm in need of an X-ray. Wow, it's been a while since I've done this. Oh my god. Hi everyone, welcome to my channel. My name is Donna from radtech.com, and I help you go from the classroom to the X-ray room with ease. So guys, it's been a while. I know I haven't posted in a bit. Every time I try to sit down to post something, or it's coming up something I have to do. So you know what, I'm at work. I have a couple hours or so to go, so I said, you know what, I need to just do this today. Right? I have some other stuff planned, wasn't able to get to it, but there's this one topic that I really want to do today. And as you can see by the title, it will be something along the lines of medical ethics does not, and I repeat, medical ethics does not care whether you're vaccinated, unvaccinated, or whatever the case is. Okay, so I had to pause for a bit. Wow, just like that. Just like that. Okay. It came back on randomly. I don't know what I was about. Anyway, so yeah, I had to pause for a bit because somebody came in to empty the bins, right? So yeah, as I was saying, medical ethics does not care if you're vaccinated, unvaccinated, if you're a criminal, if you have HIV, if you have any other communicable disease. We do not care. As the TikTok goes, we do not care. If you're into TikTok and you're on TikTok, you all know that audio that I'm talking about, right? So when I recently had a conversation, kind of back and forth with a commenter on Fox News YouTube channel, right? The video was about Biden mandating or wanting to mandate that everybody get the vaccine, and the video actually started with mention of people in general saying that you should refuse an unvaccinated person from getting into the ICU, intensive care unit. So I was like, that's what my comment was basically saying. It's medically unethical to refuse somebody, right? That's what I was implying with my comment. Somebody commented, thinking that I guess I was referring to mandates for the vaccine, which I actually, some people would disagree with me, but I don't think that should be mandated, right? If you want to take the vaccine and you safeguard yourself, that's up to you. If you are skeptical and you're not ready to take it yet, that's up to you. If you don't want to take it, that's up to you, right? If they do say that you need to be vaccinated to enter certain places, then you just face the consequences with that, and you just don't go to certain places if that's, you know, you just follow the rules basically when it comes to the places you can or can't get into, right? And that's fair. But to force somebody to take it, that's where the whole line between bodily autonomy and stuff come into question, right? Again, it's a matter of you doing what's best for you. Me personally, I have skepticism. I am clearly in the medical field. I am pro-science and I am pro-vaccine, but I am skeptical, which is why I haven't taken it yet. I think that more research needs to be done, on which they are doing, because look, recently they came out with a notice that they're now going to research the issue that women were having with regard to their period changing. So I'm in the next X-ray room now. Anyway, so I'm in the next X-ray room now because, as you can see, the room's kind of identical. They needed to get into there to do something. I don't know. I just tell them to come here because, you know, I have a little bit more privacy, I think, right? So yeah, as I was saying, they're now starting research with regards to women and their periods. Remember just the other day they were saying that this has no effect on the reproductive system. And obviously if your period has been affected, that is because of, like, your period is directly related to your reproductive system, right? It's the reason why you're having a period is because you did not get pregnant. So your uterine walls, the blood lining is shedding, right? So if you're having issues with that, then you don't know how it may, like, affect anything else, right? Which is why research is important, right? So This part of the wall not looking good. So, like research is still happening, and until I feel comfortable enough, I mean, I feel like it's inevitable. We'll have to take it at some point. Some people took it as soon as it started rolling out, and then we learn more things about the vaccine as time went on, right? So if you're feeling comfortable now to take it, you go ahead. If you don't want to take it yet, that's your business. If you don't want to take it at all, that's also your business, right? I definitely think that people should be able to choose what they do with their body. But that's not even the point of this video. The point of the video is, when you sign up for a medical job, when you sign up as a medical practitioner, you sign up as a professional within the medical field, you are administering care, whether it's radiography, right? Whether you're a doctor or a nurse, your personal feelings do not matter. When we have a lot of prisoners that come in, I work in a public hospital, right? We have a lot of prisoners that come in for x-rays. People may treat this differently, but you feel I, in good conscience, will treat a prisoner bad because they came with a prison officer and they're in handcuffs and they come to do the x-ray? No, because I am here to administer care to help them diagnose whatever they may or may not be going through. It's not my place to treat anybody bad, talk down to anybody, disrespect anybody, or refuse to do the x-ray, or whatever the case is, just because I disagree with what they chose in their life or what health issue they may have. Medical ethics does not care. When you sign up for this, you sign up to provide care, right? So when I see people saying that people who are unvaccinated shouldn't get to go in the ICU, wouldn't the non-vaccinated people likely be the majority that would need ICU access if what they're saying, if the vaccine is doing what it's supposed to do, which is to reduce the likelihood of you needing hospitalization, far less needing to go into the ICU, wouldn't the unvaccinated, right, be the ones that, that likely end up in those kind of intensive care scenarios? So that's why I was trying to put two and two together. So why people are saying that they shouldn't care for them or they choose that? I have no idea. Like, I could never. I would not refuse to care or to do an x-ray for somebody because I disagree with their politics, because I disagree with their medical health status, or because I disagree with whatever they choose for themselves. That is not my place, right? It is morally wrong for me to do so, and legally, so I don't get it. I don't know why people, the division that this whole thing is causing is crazy. Anti-vaxxers versus vaccinated or vaxxed or whatever. Is it that serious? Yes, it's a pandemic. People have died. We understand that it's a serious topic, but at the same time, the way you treat people matters. So when this person came into my comments and started being rude, I didn't even say anything outlandish, crazy, or anything like that. And I'm a medical professional, so I am aware, right? I do COVID patient x-rays all the time. Radiographers do x-rays on COVID patients all the time, whether it's x-ray or CT or whatever, right? We gown up and everything and we interact with the patients, and we hear that patients would have passed away, or we hear that patients had to be moved up to a higher facility. We know of these things. I myself had COVID at a point in time and I didn't even know because I didn't show any obvious symptoms, right? And then with the healthcare thing, I found out way after, actually, like a whole month later, that I had COVID and I had no idea. Thankfully, no one around me got it. My family was fine, So I suppose I would have built up natural immunity, right? That's another thing. Where is the research, the proper depth of research into this whole natural immunity thing? Because this was last year for me. At that time, my country probably had about, I don't think it was any more than 500 confirmed cases. I think we got our first case back in March of 2020 or something like that, right? And then we had a month where we had no cases at all, and that month felt blissful, and then all of a sudden numbers pick up and it went from there, right? At the end of it all, I just hope that you got from my message that you don't need to treat people differently based on their medical choice, right? Treat people with respect. It's the least you could do. You can disagree. You can think that they're not making the wise decision, but don't disrespect people at the end of the day, because once you are vaccinated, you are protecting yourself, right? Based on how its vaccines are supposed to work, you are protecting yourself. One could say that you're protecting somebody else, but we heard about a month or so ago that vaccinated people can spread the virus, right? And you can still get the virus in the first place. All it does is reduces the likelihood based on what they say, right? So please, just, if anything, please, oh my eyes. If anything, please just treat people with respect and the decency that they deserve. I have seen some outrageous comments with regards to this thing, and at the end of the day, people fail to realize that it's up to the person themselves to make that decision. It's honestly disheartening. I try not to take it to heart or worry about it too much, but if you, whatever you choose, just know that based on whatever decision you make, you choose the consequences to suit. So if you are way against the vaccine and you really don't want it, then that's what you want to do. You don't want to take it. If they say you can't get into the movies or you can't go dining in at some restaurant, at least you know that that's the price you had to pay to not take the vaccine, right? But if next month you do some more research, you hear some more promising things, I'm hurting, right? If you hear some more promising things and you choose to take it, then that's all up to you, right? Some things, as I say, is inevitable. At some point we would have all taken it. But I would just hope that no matter what decision someone makes, due to medical ethics at least, you don't treat people badly, right? So that's it from me. I hope you all are doing well. I really hope that I could get some more content out for you guys. We started having students on site, so that was a cool new experience for me, because you know, with COVID, students went out on site for their practicum and stuff like that. So anyway, I'm going now. Bye. I hope you all are well, and I will see you all in the next video. Bye bye.